Hey, welcome to The Explainer. Today, we're diving into the single biggest health risk for people with diabetes. Seriously, this is number one. We're going to break down the latest standards of care from the American Diabetes Association to give you a really clear, actionable game plan for protecting your heart. So let's jump right in.
First things first, let's start with a big question. We all know diabetes can affect a lot of different parts of the body, right? But what is the number one, the absolute leading cause of mortality? The answer to this really sets the stage for everything else we're going to talk about.
And there it is, cardiovascular disease. This isn't just a risk for people with diabetes, it is the risk. So figuring out how to manage it isn't just a good idea, it is the absolute key to a longer, healthier life. And that is our entire focus today.
Okay, so let's get on the same page. What are we really talking about when we say cardiovascular disease? Let's define our terms. You can think of your circulatory system kind of like a car. Cardiovascular disease, or CVD, is this big catch-all term for any problems with the engine, that's your heart, and the plumbing, your blood vessels. It covers everything from the heart muscle itself getting weaker to, the pipes getting clogged up.
Now, let's zoom in on the most common and, frankly, the most dangerous problem of them all, ASCVD. This is the one you hear about most. It's when that sticky cholesterol plaque builds up inside your arteries. It's like a slow, silent clog forming in your body's plumbing that can eventually block off blood flow and lead to a heart attack or a stroke. This is the big one we really need to get a handle on. But here's the good news, and it's really good news. There is a powerful, science-backed plan to fight this. And the secret is realizing that it's about so much more than just managing your blood sugar. The whole strategy boils down to what we call a multifactorial approach. That's just a fancy way of saying we need to attack the problem from a few different angles all at once. The most effective way to protect your heart is to manage your blood pressure, get your cholesterol under control, and use the right medications, all at the same time. This comprehensive attack plan has been proven to slash the risk dramatically. And here's the crucial part. This isn't something that just happens to you. You're not a passenger here. This is a plan that you build and you execute as a team with your doctor. You're in the driver's seat, and your knowledge and your participation are absolutely essential for this to work. So let's break down that plan, starting with pillar number one, your blood pressure. For most people with diabetes, this right here is the magic number, a blood pressure goal of less than 130/80. Hitting this target is like putting up this incredibly powerful shield that protects your heart, your brain, and even your kidneys from the kind of damage that high blood pressure can cause over time. But, and this is a big but, it's not always one size fits all. For some people who are at a really high risk, aiming for an even lower target, like under 120, can do even more to reduce the odds of a stroke. But what's the trade-off? Well, it can also raise the risk of side effects like hypotension. That's a sudden drop in blood pressure, or even syncope, which is actually fainting. It's a balancing act, and that's exactly why that conversation with your doctor is so important, to find the goal that is perfect for you. All right, on to pillar number two of our plan, getting that cholesterol under control. And our main tool for this job, it's statin therapy. I like to think of statins as your body's dedicated cholesterol cleanup crew. They come in two main strengths. You've got your moderate intensity crew, and they can lower your bad LDL cholesterol by about 30 to 50%. Pretty good. But for people at higher risk, we call in the high-intensity crew to get that LDL down by 50% or even more. And just like with blood pressure, we've got very specific targets we're aiming for. If you have diabetes and a few other risk factors, but you've never had a heart event, the goal is to get that LDL below 70. But if you've already had a cardiovascular event in the past, we get much more aggressive. The goal is to push that LDL all the way down below 55. Okay, finally, let's tackle our third pillar, aspirin. Now, this is probably one of the most debated topics in heart protection, so it is really important that we understand the details here. The entire conversation about aspirin, honestly, it all boils down to this one simple distinction. Are we talking about primary prevention, which means trying to prevent a first-ever heart attack, or are we talking about secondary prevention, trying to prevent a repeat event in someone who's already had one? Because the advice for each is completely different. So for primary prevention, the data shows it's a real balancing act. There was a huge study called the ASCEND trial, and it showed that for people with diabetes, a daily aspirin lowered the risk of a first cardiovascular event by about 12%. That's the benefit. But it also significantly increased the risk of major bleeding. This is that classic risk versus benefit discussion that you absolutely have to have with your provider.
However, when we talk about secondary prevention, the science is crystal clear. The debate is over. If you already have a history of cardiovascular disease, the benefit of aspirin in preventing another event just crushes the bleeding risk. It's not even close. In this situation, it is strongly recommended.
So let's pull all of this together. We've talked about blood pressure, cholesterol, and the aspirin question. When you take control of all of these factors together, the impact is, well, it's profound. And this right here is the single most powerful and hopeful message of this entire explainer. This quote from the American Diabetes Association says it all. Basically, when you have a comprehensive plan that treats all these major risk factors, you can bring your risk of a heart attack, a stroke, or death down to the same level as someone in the general population, someone without diabetes. You can essentially neutralize that extra risk. It's incredible. Which really leaves us with just one final thought. Knowing your numbers, your blood pressure, your cholesterol, and talking about this comprehensive risk plan with your doctor, it's not just another item on your checkup list. It might just be the single most important conversation you can have about your future. Thanks for tuning in.